We're speaking with Jeannie Harris, Assistant Professor of Nursing, and she's going to be giving the Health Pulse lecture on March 10th of Children with ADHD, The Battle Within the Mind. And can you just kind of tell me what ADHD stands for and how common it is these days?
Yeah, ADHD stands for Attention Deficit Hyperactivity Disorder. It's had its names changed several times over the course of time, but the current is now ADHD. That's where we're at. It's been around forever. In fact, we actually have some historical evidence that even in the late 1700s that there was a physician who did some work in this area. So it's nothing new, but it still remains something new to the public, it seems like. I started being interested in ADHD in the 80s because my son had ADHD. And I found it alarming how badly he was treated by teachers, school system, other parents, for something that in my mind it seems like was propelling him and that he didn't have much control over. There wasn't much information about that at that time, so I began to dig on my own. And since then, I now have 2 grandchildren with ADHD because it is an inheritable disorder. And so I have just continued my search for that, and also in my medical practice as a nurse practitioner, I worked with many ADHD children.
What's the greatest challenge when treating people with
ADHD?
ADHD.
The parents. The parents. Getting the parents to understand that this is a biochemical and genetic disorder, that it's not something that their child wants to have. It does not mean that they're not trying hard. That it's truly a chemical process in their brain that's just different from other children. And we tend to treat children with ADHD in a way that suggests that you could fix this if you wanted. You don't need medication. And it's a little bit like telling a diabetic, you don't need insulin, you just need to overcome this. And so getting parents over that hurdle of being willing to think about giving their children medication to help them.
Well, what are some of the resources that are available now that maybe weren't 10 or 20 years ago?
Well, actually, there's just information everywhere if anyone chooses to access it. I know that teachers go through training on ADHD children while they're still in school, and I know that they have sessions about that, but I find out there in the school systems, it's still not much different. But certainly it's just easy to get on the web and find wonderful places there to discuss it. Any of the children's hospitals have great websites about this disorder. The NIH certainly has good information about this disorder, so it's really easy to get in there and find out things that you want to know.
Okay. Anything you want to add about the lecture?
I think it will be good information, and for some people, new information. I'm hoping that it will enlighten some eyes to what we are putting children through with this disorder and how we are treating them and how that just needs to change.